I can let everyone in if you'd like.
Okay, guys, let's rock and roll.
Make sure that we're done.
Oh my gosh, yes, it's perfect. Thank you. It's perfect. Thank you. It's perfect. Thank you. Let's see if I can mute people.
I'm here. I have two.
Okay, Amy, please let me know when we have everybody.
I feel that there's still some folks trickling in. Maybe we give it another 30 seconds.
Sure.
But I think we have a pretty good attendance here. Just let a couple more people in. There's always people jumping from one meeting to the next, so we'll just give them another 30 seconds and then we'll get started.
Sure, no problem.
Okay, Ala, it's 2:01. I think you should go ahead and.
Okay, Amy, thank you.
Yeah.
Good afternoon, everybody, and welcome to our outpatient surgery data reporting webinar. And I just want to welcome you to our meeting and let you know that this meeting will be recorded and later placed on our website. And a few housekeeping rules. If you please hold on the questions until we open the floor after each section, so you can ask your questions by raising your hand or putting the question in the comments area, and we'll answer your question as we go. And I would like to introduce you to my OHS team who will be presenting today with me. And my name is Ala Weberman. I'm an associate research analyst with OHS. And Joseph, please.
Yes, my name is Joseph Roos. I'm an IT analyst working for BITS for OHS. And I would like to introduce Olga.
Thank you, Joseph. Good afternoon, everyone. My name is Olga Arma. I am Manager for Research and Planning at OHS, and I'm here to help field your questions. Thank you for joining us. Amy?
Thanks, Olga. I'm Amy Tybor. I'm a lead consumer information representative with OHS's Health IT unit, and I am here today supporting with facilitating the meeting. And I'll turn it back to you, Ala.
Thank you, Amy. And I believe we have majority of people are present. So we're going to continue with our presentation. And as you all aware that Connecticut General Statute and regulations authorize the Office of Health Strategy to obtain encounter data from outpatient surgical facilities and hospitals. Healthcare providers file demographic, clinical, and financial data on biennial basis. Data submission are based on the federal fiscal year and are due by January 2nd, and that covers April to September timeframe, and July 1st for October and to March time period. And below you can see the time period for each of 4 quarters. Effective today, December 16, 2025, outpatient surgical data reporting will move from SFT to the website here on the screen. And new platform simplifies the process of submitting and validating encounter data files. It's also designed for ease of use and better navigation. It will provide more timely feedback on file format and errors, and it enhances data quality through automated checks. And today, during our demo, we will show you how to register and how to create an account. Also, how to map your account to the facility or facilities if you're filing for several facilities. Uploading the data file into the application, how to identify failed uploads and content issues, and also we'll share some other function. And for more information on outpatient data submission, you can visit our website where we put this recording. Also, you can contact us using the email provided with the subject line outpatient surgery data reporting. And with that, I'll move to Joseph, who will share his screen and will show you step-by-step demo how to do all these steps.
Hello, this is Joseph again. Just wanted to have an interactive presentation. So my goal is to present the application to you, but also receive the questions so we can all be familiar enough with the application that we could use it successfully. This is a new portal. You received in a user guide a link to the new portal. You should have the link there. And we're going to start with the user login section. On the user login screen, we have create a new account option, and we have login section. I already have the account created, but I do want to explain briefly here the fields. When you register for the first time, you would enter the name, the username, and the email address. For the mobile phone, if you wish to use a mobile phone, you can certainly do that. You enter your mobile phone and then set your password and sign up. So that would be the basic setup. Each one has to create an account first, even if you submitted data before, because this is a new system. But you could use the same credentials, the same email, so it should not be a problem. So I'm returning back to the sign-in screen. On the sign-in screen, we have the login. When I click, I try filling the username or email, so you can use either or. I know before the username, some people could not remember their usernames because they haven't used the system for a while, and now it's a little bit easier. You just use your email address and the password. So when you click login, you will get this prompt. So I'm going to check for my code on my phone. And I'm logged in. So if you after you log in, if you desire to make changes to your account, you have the following options. Here you have the preferences. You can add a phone number if you didn't add when you registered. You can also change some of the profile information here. But most important, I would say, if you get a new email address, it's important that you go in and change it. So this is where you would change your email address. And also the password. Let's say you set up the password and you wanted to change it here to something that you remember easier, you can always do that once you're logged in. So this would be for the login. Of course, there's the option forgot password, and then that you can do when you log in, before you log in. So this one here is just the basic setup for the account that needs to be created. So at this point, I want to ask, is it all clear? Do you have any questions in setting up the account?
I have a question.
Sure.
Is it one centralized user per facility?
It's a very good question. So basically, if you submit for multiple facilities, you only need to create one account. You don't need to create more than one account, and you can submit to as many facilities as you need to.
But with the one facility, can you have multiple users on there?
Yeah, absolutely. You can have multiple users for one facility, and you can also have one user submitting for, or multiple users submitting for multiple facilities.
And
So
is
there's
one person identified that the administrator who manages the users, or anybody can just add themselves?
Yeah, so we administer it from the OHS side, but also users should be able to administer their users for the respective facility. But this part, so what I've shown you so far is really about the login account. There's another section that is going to follow after this, and it's going to refer to the facility mapping. And that's where you can see a little more to this. So as far as the creating the account, do you have any other questions? Okay. I hear none, so we're moving on to the moving up to the next section, and that would be the facility mapping. Now, here I already mapped my account to test facilities, just so I can show you how the screen looks like. I don't want to go through the process of selecting the facility and getting approved, because we don't want to use that much time for that. But I will say that once you click on this here and you select the facility, let's say I'm selecting this, it automatically appears here. All I need to do after I selected what facilities I want to map to, I'm going to go here and just click submit. And that would be the only thing that I need to do. If I refresh this, it will go away without submitting. So once you submit, what's going to happen is you will receive an email. The email is going to say that you requested to submit data for this facility below, and it goes in an under review status. Here, an OHS admin will just approve your account, because we want to make sure that not everybody has access to your facility submissions. So we just want to confirm that, okay, this is the person submitting for this facility. And then once you receive this email, you will wait until the request is approved. When we approve the request, it's going to show up just like it's showing on mine. You will see the status approved here. And then, of course, you will receive an email that will confirm your approved status. You don't have to keep these emails. There's nothing like keys or password or anything into it. but it is a good reference if you want to keep it. So if you ever need to refer back to it, you have it for your history purposes. So that would be for inpatient, outpatient, emergency, and obviously today we're going to focus on an outpatient facility. Now, for the outpatient facility, we have file uploads, and we also have manual uploads, manual entries. Today, we're going to address the file uploads. But as far as facility mapping, do you have any questions?
Nope.
Okay, that's good. We can move on to the key element here, which would be data filings. Here, we could see that we have multiple options. So you have inpatient, emergency data, outpatient, utilities. For the outpatient, we have upload outpatient data, which we're going to do today. And then also we have the convert, which we're going to address today as well. So let's start with the upload outpatient data. So here we have a simple screen where you have the option to select a facility. Now, if you're mapped to more than one facility, which in my case, I am mapped to 2 facilities, then you can choose for which facility you want to submit. So if I'm selecting this facility, I can choose to submit for that. If I'm selecting for this, I'm going to submit for that. So I'm going to choose the file that I want to submit for. In this case, let's say I'm going to UIT. So whatever you have placed the files, but it's on the network or local, you have the option to just go there. In my case, I just choose this. So all I'm gonna do, copy the path, paste it in here, and I'm here with my file. So I have 2 file types today just for demonstration purposes. If I'm selecting this file, you notice that in the file name we have the word copy. So it doesn't matter what other words you add or change or what happens. If it's not the format requested, it's going to give you this error, invalid file name. Yeah. There's not much to worry about this. You can change the file name very easily, right? So we go there, we change the file name. So in this case, just to make it faster, I put the correct file name in here. So I choose the correct file name. Now I'm going to say upload. This one is telling you that at this stage, the file is uploaded and is currently under validation. And you can see the status here, pending validation. So if you wanted to refresh the screen and see, is it still pending? Yeah, it's pending. So I'm going to look in the meantime, because it's still pending, it's still processing, going through all the checks and validations. I can go and pick up another file. I'm submitting for another facility now. So I'm going to the file, picking up the next file, and I'm going to click upload. So now it's telling me that this one is pending. The other one apparently already finished, but it said failed. So in this case, I want to check to see what's wrong with the file.
Incoming.
But what's, yeah,
So,
did you have a question? Okay. So in this case, we have the failed status. what we want to do, we want to click on download. And then here, it gives us the option to download or just to look at the errors that we have. Now, there's a lot of errors that we put in here for demonstration purposes only. So if you look in here, it will tell you, it will have a description for each error. And of course, we have the appendix file, the Excel file with the lookup values. We can reference that to see if we use the correct code and fix it. The way we fix items that are that have an issue, you go in your system, you fix your errors, recreate the file, and then you come back and resubmit. Now here, let's say I'm seeing this, but I wanted to export this to an Excel file to save it or to review it later. You have that option to save it. So I'm not going to do it because I'm not going to get into details at this stage. So I know that I looked at the errors. I went into my system, I fixed them, and now I want to resubmit. The moment you go and resubmit, once is successful, you get the status completed. So if the status is completed, that means that the threshold, which is 3% error, less than 3% errors, it's completed successfully. So you have less than 3% errors. Now there might be some errors, a few errors in there, but because it's less than 3%, we're gonna accept the file. You can look at every successful file submission. After each one, you will receive an email like this: Outpatient encounter data file upload status. Dear user, and this is just a sample. Of course, it says that encounter data has been uploaded and processed successfully. We will contact you if we have questions. So that would be the successful submission. Now for the errors, you will receive another email. If the file didn't go through, it didn't complete it successfully, then you will receive an email with your facility and the submission period, and it will tell you a summary, not the details, just a summary of the errors here. And let's say you have one of the errors that you're not sure about it, like invalid pair ID or whatever. You could check the reference file, the appendix, corresponding with the pair ID. But if you're not 100% sure, of course, you can reach to us, and then we'll work with you to assist you in getting the proper value or the proper IDs. So that would be the file upload submission. This is going to be the most used one. So there's no guarantee on how long it takes to upload this, but as you saw, the sample files that I used were fairly quick. It could be minutes, seconds, minutes. It could be a little more, depends on how big the file is, on how many people submit their data at once, and on the network traffic as well. So with this system, obviously, the advantage is evident. I can see my errors. I can see when it was submitted. Let's say that another person submitting for the same facility submitted, and the status here, it says completed. That means that I don't need to submit anymore. It's completed. It's done. So it shows you here, you know exactly without anybody telling you that the file is submitted and you're all set. So that would be the outpatient data upload. At this point, I can take questions.
Yep.
So, do we have any questions?
I'm not seeing anything in the chat, Joseph.
Good. So that means that it takes time to process. And it's a good thing. As we get more familiar with the application, I'm sure questions will come, as they always do, and we're here to assist with whatever questions you have. So that would be the outpatient data upload section. Now we're going to move on to the convert outpatient file from old to the new format. And what that means basically is that I'm going here. This is my old file format. I'm picking my file. I'm going to say download the converted file. And as you can see here, we have the file name, and we added the word updated. That is just for your reference, so you know, oh, this is the updated file that I have. So I'm going to save this in the download. And it went there, so I wanted to show you. This is the file that I just created. Now I can go and say, okay, I downloaded. I want to submit it because the file is ready. Now this solution, this tool that we have is a temporary solution. We do not encourage you to use it too much, only as much as you need it until you change to the new file format for the system. So with the new file
Joseph?
format, yes.
Sorry to interrupt. There is a question in the chat. Where did you go to convert the file? Is a
Yes,
question.
so under data filings, so I'm clicking here. Under utilities, you go to convert outpatient file from old to new format. You click on it, and then here you would pick the file and you would say download the converted file. The system will convert it for you. So this, like I said, it's a temporary solution. After we do this, then we can come back here to upload the file. Do you have any other questions? Did I answer your
Do you
question?
see one other
Wasn't
question
it
here?
about an invoice?
Sorry, I think I might just have to mute someone. Hold on. Okay, where can we download the new file specifications?
That is something that Ala sent out already, but if she didn't, she can always send it to you. We have it also listed on the website.
And Joseph, I would like to add that new format means that you implemented the race and ethnicity, disability, and language codes. So if your data has these codes, you already converted to a new format, so you don't have to convert your old format, which means you still don't have those codes. And as Joseph mentioned, this is a temporary option. And while some of the facilities are still implementing the race and ethnicity, disability, and language codes. And you can look on the details of those codes if you look on the appendices file, which is on our website and will be sent to you after this presentation. And you can look on the details of those codes.
Yeah, so after you converted the file, then you can always return here, and I'm going to say, oh, I want to resubmit the file. So now when I go here, and I'm going to look for my downloads folder because I put it in there, and say, I want the updated file. So what's going to happen if I don't change the name? I will receive this error message. So basically all I need to do is just change the file name, and I change the file name to this, and here is my correct file. Now what you're gonna notice here is if I try to submit twice and once it was completed successfully, the system will say that this file has been submitted to resubmit contact OHS. And the reason is because we accepted already your file, and it's less than 3%. And we don't want to override it without first discussing it to see if it's necessary. It could be that by mistake your new file might have more errors than 3%, and you would basically overwrite the good existing file with one that has more errors. So always in a case where you feel like you need to override the file, we wanted to have a discussion and check the file to make sure that we're not overriding with anything that has more errors. So that would be basically the outpatient data upload, including the conversion tool. Now, do we have any questions on those?
I have a quick
There's
question.
a few remaining questions in the chat, and I think Ala might be addressing some of those. And we also have a person with their hand up, Lisa Winkler.
Sure, please.
Lisa?
Hi, folks. Thanks so much. Just when you were going through the data on race and ethnicity and disability and things like that, I just wanted to check if those were mandatory fields. I know in the past, sometimes it's challenging and people do their best to sort of gather that information, but is it a mandatory field, and is there a code, and maybe people know this already and I apologize, that you put there in the event that you don't know, or how are we handling that, I guess? Thank you.
Sure, I can refer this question to Ala or Olga.
I can take it. Thank you, Joseph.
Sure.
Those fields are mandatory. And we do have a special appendices, like Appendix 7 for race and ethnicity, which has all the available codes. And we do have some codes which are applicable for situation then the person declined to identify race or ethnicity, or when the facility is unable to collect, or the person not sure or don't know. But we encourage to put your best efforts to collect this information, because those fields are mandatory. And I know that some people asked about old and new format. So when we talk about old format, that's when you do not have those codes, race and ethnicity, and the disability and language. So when you are still implementing to have those codes in your data sets, and you are in the middle of that. So for those facilities, we created this tool which will help to automatically include these codes into your data set. And Joseph shows you the sample of the data file, which goes through old to new file process. Also, it's number 33 on page 17 slides, which shows you this particular view, and the system will automatically put those default codes for you to transfer your file from old to new format.
Thank you so much.
You're welcome.
You're welcome. Did you have more questions? Did that clarify it?
May I add, this is Olga, may I just add that
Sure.
there was a question about if you don't have the information, should you use the old format? It will be good if you transition to the new format, and then try to populate the fields with the unable to collect information for now, right? Until you're able to collect the actual information. So don't stick to the old format of reporting. Just transition to the old new format where we have 4 race, ethnicity fields, and 1 language, and the disability, the 6 disability fields.
So basically, we realize that there is a transition, and then some people have a vendor, or some of the facilities have a vendor, or they want to use their IT people, and the IT people might not be clear on what's needed. You can always send us a question, and we'll be happy to explain it to you better if it's needed. We can also take like a test file. Let's say you have a file that you want to submit and you're not sure that it's in correct format, without and it doesn't work through the system, you could just contact us and we'll work with you so you can have it in a correct format.
Thank you so much. Can I just ask, what is the next filing deadline for the data upload?
Yeah, and the next filing deadline is January 16. So that will be for data which you usually submit by January 6th from April to September of 2025. That will be your 2025 Q3, Q4 data set.
Yeah, and the reason for the extension is because we're just getting into this new system, right? So we understand that a little bit of time might be needed. So January 16 would be the date.
I think I speak with
Right.
everyone when I say thank you. Thank you for that reprieve a little bit.
You're welcome.
We do have a couple of questions in the chat regarding disability data collection. I'm not sure if
Yeah.
you've been able to.
Yeah. And for disability, we have for disability codes, is there a response expected for each disability question? And if you look on the appendix 7, I'm sorry, disability appendix 9. So we expect that you provide us, not you, the person will identify at least one disability. And if the person identify just one disability and all other fields are empty, we'll ask you to put code 800, which stands for unable to collect disability. So basically each field needs to be a field for disability. If the person provides 2 codes, you use 2 codes, and for other 6 codes, you use this default 800 unable to collect disability code. And you can also look on the sample file, which is the 3rd tab on the appendices file. It has an example how it will look like in your file for disability codes submission. And also we have a question that our practice management software is able to collect race, ethnicity, and language, but not disability. Is this going to cause an issue with the file submission? So because we need to have the disability as well, so your file is, you need to convert your file from old to new format, and the system will automatically assist with that missing disability codes for you. And
lastly, before we move on, Shannon Hayes has had their hand up. Just
Yeah.
want to make sure.
Sure, absolutely.
Yes. Hi.
Hello.
I was just wondering, are you going to be discussing the results of the tests that y'all had some of the facilities do, like to test the new website, the new filing? Is that going to be discussed at all? Like the results of that?
Well, we address each submission individually, so
Right,
we
yeah, I didn't mean like specifically what center did what, but I just didn't know if y'all had any success. So were there any successful
I can,
files versions?
Okay, so what I wanted to say about this is a new system where we're just presented this and people will register, so we will definitely know more, but I do not foresee any issues. We tried it in different scenarios. We had some external vendors willing to test the system, and it went good for some. For some, they had the suggestions or indicated some of the issues or whatever it was, and we addressed them all. So we don't foresee any problems with the system.
Okay, I
So-
was just wondering if you had any
Yeah.
success rate because I'm having issues on both, like whether I use original or converted format.
We'll be glad to assist you. And the one thing is, we have the new file format now. You know that we have the converter. So if the old file format is what you have, then we can convert it to the new one. Now, the new file format, I realized that either you have a vendor or do it yourself. So sometimes you might miss a field or value and it wouldn't be able to read it. So that could be where we can collaborate and you send us the test file. We work with you and tell you what the issue is so you can address it. And we can certainly address. I don't foresee any impediments where we're gonna say, oh, this is something we cannot fix.
May I
Understand.
just add, may I just add that if you're having problems, we can do a one-on-one offline to find out what the issue is to get to the root of the problem.
Yeah,
So
absolutely.
yes, we'll contact you.
Thank you.
You're welcome.
You're welcome. Do we have any other questions? Okay, so I don't hear any questions.
And we have a question in the comment section. Can someone please explain the reasoning behind the collection of race, ethnicity, language, and disability data? What is it being used for? On multiple patient satisfaction survey, we have received pushback on the collection of this data.
Yeah, so I would ask Olga if she wants to speak on that.
Yeah, I can take that.
Okay.
For one, we're collecting that data because it's the law. There's a statute that requires all state agencies to collect the data and in a particular way, and that's why we have the standards. The statute authorized OHS to create the standards for all agencies to collect the data in a certain manner. So that's one, the reason why we're collecting that information. Two, in Connecticut, there's health inequities in various communities, and it's one of our missions to improve health in the state, and so targeting those inequities require us to have data to support the work that we're doing. So for Connecticut and for OHS specifically, we are collecting that data to support the healthcare planning, statewide planning that we do.
Thank you, Olga.
Welcome.
Do we have any other questions?
I just want to check with David to see if he's satisfied with the answer or he needs us to follow up.
I'll put the statute in the chat.
Thank you. All right,
Yes.
Ala and Joseph, please go ahead.
Okay.
Yeah, so with this, I want to conclude the presentation that we had planned for today, because these are the areas that we covered. Obviously, we can receive more questions after if you have, and we can assist you, like we said, with the setting up the new formatting, as not everybody has managed to do it yet. So we will most likely have another webinar at a later time, getting into more details as needed. But for today, this is what we have. Thank you very much.
And there's another question I wanted to add. Who do we reach out for assistance? So please use our ohs@ct.gov email address, or like the old ways to reach out to us. Nothing changed, like you can do it like you did before. We're still here. We're not moving anywhere. We just have a new system, but everything else is the same, all the requirements. And so this webinar will be posted on website, like we mentioned before. And also you can find on our website the updated appendices file for 2025 Q3, Q4 submission. And if you, and also a guide, which was emailed to you, also posted on our website. So if you have any other questions, and please don't hesitate to email us. And I think Olga put our email address on the comment area, so you can use it as well. And I think if there is no more questions, we would like to thank everybody for joining us today for webinar. And I think that will be it for today. And have a good day for the rest of your day. And we're giving back you 14 minutes.
Thank you. Merry Christmas.
Thank you.
Thank you.
Christmas.
Thank
Thank
you.
Happy
you.
holidays,
everyone.
Thank you. Happy
Yeah,
holidays.
happy holidays.
Happy holidays.
Thank you.
you.
I think we can leave this chat and reconnect using the different channels.
Yeah. Sounds
Okay.
good.
Yeah.
Thanks.